pouch of Douglas, that space between the uterus and the rectosigmoid portion. Okay, very important ito because this pouch is part of the intraperitoneal cavity in the abdominal cavity or peritoneal cavity. And in infections or in rupture of viscous rupture of the fallopian tube, the uterus, everything here will be filled with blood. So my blood, it will be that pouch of Douglas. The same is true when you have an infection and my nana, there's pus everywhere here, or my appendicitis, you will have pus here, no? Purulent material in the pouch of Douglas, or we call this the cul-de-sac of Douglas, posterior cul-de-sac of Douglas. Huh? Okay, so this is the uterus. You should know the 3 layers. Ito naman yung rectosigmoid, and this is the urinary bladder. When we do a cesarean section or an operation in the reproductive system, we have to empty this bladder first by applying or inserting the urinary catheter, para inihiya, it is what's this, empty, and so it will not get in the way if we do an operation in the uterus. And note that we have here the uterus, the ovary, and the fallopian tube, and the ligaments. Okay. Okay. So next, we'll discuss about the cervix. Ano yung cervix, Mr. Artuge? What is the cervix? Mr. Artuge?
Narrow lower neck of the uterus which projects into the vagina inferiorly.
Okay, so ibalik natin para. So ito yung cervix, this one, di ba? May araw ba dyan sa ano nyo?
Yes, Doc.
Okay, so this is the cervix, What is external here? What you will see, pag maggamit kita ng speculum, no? We insert a speculum and we view from the vagina here, no? You will see the external orifice of the cervix, And then dito sa portion na to is the internal cervix. Okay? So it is a narrow lower neck of the uterus. So ano to siya, inferior portion. It communicates with the vagina sa gawas and into the uterus inside. Okay. Now the cervix has cervical glands that secrete mucus that covers the external os, and sometimes it will block the sperm from entering into the uterus. May mucus plug. And the same thing, ini nga mucus plug, ito yung mag-herald ng starting of labor, because when labor starts, the mucus plug will be discharged from the mother, from the parturient. This is mixed with blood. So we call it the mucus plug. Okay? Pag gumawas na itong mucus, no, at the time of labor na may kaya blood, then di maiha magle-labor na pasyente. So this one is the cervix. We have the external os dito, and we have the internal os here. The external os will have a different lining epithelium. It will it will have the same lining of the vagina. So anong lining ng vagina kaya? Janelle Morgalio, alam mo yung lining ng vagina? Pareho siya ng lining ng esophagus. Pareho siya ng lining din ng ano pa? Skin. Pero yung skin, keratinizing. Okay? Keratinizing. Ito siya, stratified squamous Ang lining ng vagina is stratified squamous non-keratinizing. Okay? So the external os will also have the same lining, stratified squamous non-keratinizing. Sa skin, keratinizing. Okay? It's different in the endocervix or internal os because it will be lined by same lining of the uterus. Ano yun? Columnar epithelium. Okay? This one is covered by columnar epithelium. Simple columnar epithelium. While this one here is stratified squamous non-keratinizing. Hindi na po-produce ng keratin. Okay? So we are still in the cervix. Now, have you heard about pap smear? Mr. Capon, Clint, have you heard about pap smear? Diba, ang isang babae, a woman who is sexually active will have to have a yearly or every 2 years na pap smear. Pap smear meaning we get some specimen from the external os and then a smear from the fornix and the internal os. Okay? And we get it from the statocolumnar junction. Huh? Okay? So that we'll be able to see if there are some changes in the cells of the cervix. Huh? Kasi dyan nagsisimula yung cancer of the cervix. Okay? So we get the pap smear and then we subject this to histopathology. And the pathologist like Dr. Lasaka will report whether there is an abnormal cell. Okay? Kung ano niya, may dahil cells na cancerous. Okay? Pag wala, then it will just be read as normal. Okay? What is the lining again of the internal cervix? Miss Coretana, anong lining ng internal cervix?
Stratified columnar epithelium.
Yes, columnar. Simple columnar, just like the inside of the uterus. Okay? Aurel ninyo, ano naman ang lining ng ng external os of the cervix? Aurel ninyo, anong lining ng external?
Stratified squamous, Doc.
Ano?
Stratified squamous.
Stratified squamous. Keratinizing or non-keratinizing?
Non-keratinizing.
Non-keratinizing. Huh? So, actually the same ang lining niya with the skin. Pero yung skin, ano yun? Keratinizing, non-keratinizing?
Keratinizing.
Keratinizing. So, there are keratin that you will see pag skin. Huh? Okay. Ano ang what is the functional significance of having to know the cervical lining epithelium? Pastor, Gwyneth K. Why is it very important to know na anong mga normal lining ng external cervix, internal cervix, or
Is it to identify if cancer develops po?
yeah, when we do the pap smear, anong age nyo ngayon? 21, 22? Kayo? 21, 22, 23? Ano?
Yung pap smear, Doc?
Hindi, kayo, anong age?
20, we're around 23 to
23, okay.
above.
Pero if you are already married and you're sexually active, then you have to submit for a pap smear. Kasi makikita doon kung may transformation ng cervical epithelium. And sometimes the transformation may call for an early detection for cancer. So, usually, ang nakamayada hini nga mga transformation or changes in the cervix are those who are sexually active, married, o kaya yung mga kahit below 20 pero they have a different job, different work, the oldest work in town. So, yung mga, the nice girls at night, they have to have pap smear. Okay, so from the cervix, we go down, we go to the vagina. It is a thin-walled tube lying between the bladder and the rectum, extending from the cervix to the exterior body of the to the exterior of the body of a woman. Okay. There are three coats of the vagina: the fibroelastic, the smooth muscles, and the stratified squamous mucosa. So as I've said, the vagina has a stratified squamous mucosa, but it is non-keratinizing. Okay. In the near the vaginal orifice, it forms an incomplete partition called the hymen. Question: if a woman does not bleed during first coitus, does not bleed, ibig sabihin ba hindi na siya virgin? Judy Ann. It is a thin covering, no? But it has to have, a hole in it. Otherwise, the menstrual blood will not be able to come out. What do you think? Queenie Cabello.
Hello,
A
Doc.
woman na sa hymen. Pero does it mean na pag on first coitus, hindi siya mag-bleed na hindi na siya virgin?
I think, Doc, it's not necessary po. Parang it's not necessary po kasi sometimes hymen is not present in all women.
Yes, correct. Because sometimes ang hymen is just a very thin thin covering, and sometimes it is very elastic. Elastic siya, and kahit may contact siya, hindi siya nasasamad, kumbaga. It will not tear. Because it is elastic. Okay? So it does not mean na hindi na siya virgin pag siya nag-bleed. The vaginal fornix is an upper end of the vagina surrounding the cervix. And then the vagina contains many blood vessels and connective tissue. Although it is covered by a thick muscular layer. Pero marami siyang blood vessels. Okay? Now this one here is what is this tissue here? This is the lining epithelium, no? Which is the stratified squamous non-keratinizing. No? And when we do a vaginal delivery, no? Pag mag-assist tayo ng vaginal delivery, we will know that sometimes there will be tears in the vagina, and this will cause some bleeding in the patient. So, we have to suture, tatahiunta, no? Kung magpaanak ka mo and then the patient will bleed, then you have to look for the bleeding site and suture, tahiun, kung ha ito nag-bleed. Okay? And since I said that there are many blood vessels here in the vagina, no? Sometimes a woman will bleed profusely upon sexual contact. So I was, siguro mga 10 years or 15 years ago, no, I was on duty at St. Paul's Hospital, and 2 times adto na may gindara. So there was an emergency, no? Gindara emergency room because the woman was bleeding, and we learned that she had sexual contact. She was a teacher, so mga 40 years old na, and apparently, ano lang to, anyway, di makamarang ngaran. I mean, teacher siya na medyo, kuan na yun, oldie na, and she had a boyfriend na, seaman. So, ang seaman, umulpot. And then, you know, what happens next? I mean, kaya man ang teacher nga kuan nga, very naive pa, and Nindaraya Hospital ka nagbe-bleeding siya. And it is because of a vaginal tear upon first contact. So that's how really one can bleed pag may ada trauma in the vagina. So hinahinaya la it mga first timers. Okay. We can go next to the, may pangayon ako dapat i-discuss. The vagina is very contractile, or what's this, elastic rather, no? Because, you know, in normal delivery, maagi that ulit baby. You know how big the head of the baby, and it will pass through the vagina. In ordinary cases, wala mangyayari doon, it will just dilate. Dilatable ang vagina. So, it will just dilate and will lead the baby out in the external. Okay? So, muscular siya, but it is elastic, no? Dilatable. So, the baby can come out. Okay? Now, for the medical students like you have to know the association of all these parts of a woman, okay? Where the mons pubis is a fatty pad over the pubic symphysis pubis. Ang mons pubis pala of a woman and a man is different, ang pattern ng pubic hair. In the mons pubis ng female, the pattern is an inverted triangle, di ba? Inverted triangle. But for a man, yung pattern of the pubic hair is a triangle kasi yung point ng triangle is up. Okay? Ganon. Okay? Can you imagine? Mr. Bano, can you imagine the pattern of the pubic hair in a male and female?
Yes po.
Oh, diba?
Since we've discussed na po sa
in the female, and then the up, yung triangle talaga na up, right siya. Yun sa male, diba? Yung pattern ng hair papunta sa taas. Okay? And then, at this time, external genitalia, no? You should know where the labia majora is and the labia minora. Okay? These are folds of skin circling the vestibule, where you will have also the urethral openings and the vaginal openings. And then you have the clitoris and the ball of the vestibule. The so-called area between the vagina and the anus or the anus is called the perineum. Okay, so this one, ay lakang pagtawa because really you have to memorize. Why? Because when you become clerks or PGIs, you will be asked to catheterize, or insert the catheter in a woman about to have a cesarean section, an operation for a hysterectomy or removal of the ovaries or whatever is there, cyst, may ovarian cyst, so dapat magka-catheter ka. So by this time, you should know where to insert the catheter. Okay. So this is the mons pubis, and you have a different pattern, di ba? You have here the clitoris. So you should note that the urethral opening or urethral orifice is between the clitoris and the vaginal opening. Here, okay? The vaginal opening. So dapat, you should not have a problem kung naka-leftotomy, no? When, you know, the woman is lying there in a leftotomy position, kasi you will be able to find it, the urethral opening, ha? So, ayaw pag-insert dito, ha? Queenie, insert it here, ha? What is the urethral catheter, ha? Kasi you will not really get your urine from here, no? Dapat dito siya, okay? Okay. Now, since ano naman lang kita, no? When you become residents or become consultants, you might be called to a rape case. Rape, okay? Labi na po mga 10 years old, 11 years old, mga ganun, no? And or in a lady na claiming to have a rape case. So what we have to study in a rape case is the hymenal laceration, okay? Ito siya covered by the hymen, and we have to note kung old or new na. It's an old laceration or a new recent laceration. And we compared the laceration in the orifice of the hymen according to the clock, just like a clock, 12, 1, 2, 3, 4, 6, 7, 8, 9, here, 12. Okay, 12. So, kung may laceration dito, it's 12. Pag dito, 3. Pag dito, 6 and 9. So, you will describe the laceration as old or new laceration at 3 o'clock position. Or is it complete or incomplete laceration? Huh? Sometimes kasi, you will be able to find an old incomplete laceration. So, dito makasiring na rape ito yan. Okay? So, old laceration. Kasi usually, we do the examination after, within 1 or 2 days, dapat mag-report na yung babae na na-rape siya. Otherwise, mapipaglit niya kaso. Kay old na laceration. Malay ko kung may boyfriend siya nung isang buwan, di ba? So, dapat new laceration kung rape. Okay? And this is now the anus. And we do the episiotomy, no? During labor and delivery. We cut it here, no? We cut before the baby's head comes out. We cut by means of a scissors dito, no? We call it a mediolateral incision, episiotomy. So that we will aid that head to come out sa vagina, no? From the cervix down to the vagina and out. Huh? Okay, so dapat alam mo yung labia majora, labia minora, the urethral opening, the vestibule, the hymen, the perineum here, and then the anus. Of course, the clitoris here, the mons pubis. Memorize na? Ha? Memorize na? O, sige, memorize na, ha? Huwag kayo magkakamali kung saan yung insert yung urethral catheter. Ha? Okay. Now, in the perineum, no, there is a Bartholin's gland. Yung Bartholin's gland, usually, it does not form a mass. Okay, very small lang siya, no? It is on the sides of the vagina, no? And the vestibule. Rather, the mons. What's this? The labia pala. The labia, no? It's on the sides of the labia. Okay? Sometimes a woman will come to us because of an enlarged mass in the vagina or in the perineum. And it is painful, it is reddish, and the woman cannot even walk straight. Huh? Masasabtan niyo talaga kahit talaga the woman is in pain. Masa niya nga, makuri pag-ihi, she will have difficulty of urinating, and sometimes she will be febrile. And when you look it up by a examination of the perineum, no, you will find that there's a huge mass here, like a fist-like. Dito, meron siya on either side, right or left. And it is because of a Bartholin's abscess. The Bartholin is a gland located on each side of the vaginal opening. And normally, no, the function is to lubricate the vagina. But sometimes the ducts are obstructed, okay? And they become Bartholin's abscess. Abscess. Okay, when you have learned this, no? Kung may abscess, ano man ito sunod nito? What do you find in an abscess? Noel. Noel. Anong sunod nito ng abscess?
Pus.
Pus, yes, purulent discharge. So the Bartholin's abscess will have purulent discharge or pus inside. So the treatment here is for drainage of that pus, and sometimes we do a incision, no, and drainage, IND on that. But magbabalik-balik ito yan, no? It will just come back. The abscess will just come back. So what we do now is do a marsupialization of that abscess. So we incise the abscess, and then we drain the purulent discharge, and after we suture so that it will just open, no? We suture the sides of the incision, huh? Para magginawas na iya purulent discharge. It will not go back to its original nga magbabalik-balik la ito nga pus, no? We leave it open in the so-called marsupialization of the abscess. So we just review about oogenesis. I've said, during fetal development, you will have your primary oocytes, 2 million at birth. When the baby girl is just 7 months or 5 months, you will have 7 million. Pero pag at birth, it is 400,000. 2 million. 2 million at birth, 400,000 at puberty. Okay? 7 million, pero at birth 2 million, and then when that girl goes into puberty, 400,000 na lang. Then each month, there'll be hormones that will cause the follicles to develop. What hormone is that? What hormone will help in the development? Again? What hormone?
FSH.
Yes, correct. Follicle stimulating hormone, FSH, okay? Until such time, it will be ready for ovulation. Huh? And then you will have the ovulation, and you will have the secondary oocyte here. So we'll have meiosis 1 and meiosis 2 during the cycle of a woman. And here you will have the cross-section of the ovary. Okay, ovary. This is now the ovary. It is covered by the fibrous capsule called the tunica albuginea. There are two parts of the ovary. You have the cortex and the medulla here. Cortex, ito siya sa external, no? Just below the capsule. And the central portion is the medulla. In the cortex, you will find the follicles in different stages, okay? You have the primary follicle, secondary follicle, and then after ovulation, you will have now the corpus luteum. Yeah, okay? Corpus luteum. Here is the mature Graafian follicle. Remember that there is an egg here, and it will be extruded out. This egg will be extruded out externally. It is called ovulation. Okay? And this occurs on the 14th day of the cycle. 14th day. Usually, it will be caught by the fimbria in the fallopian tube and then ma-fertilize siya doon. Okay? So the follicles are found and the oocytes are found in the cortex, while the inner medulla here. This is the medulla. It is composed of loose connective tissue with vessels and nerves inside. Okay. The medulla will have its hilus, no, inside, which will house your nerves and the vessels of the organ. Yeah. The hilus, the nerves and blood vessels. Ito yung cortex. This is the cortex. Ito yung hilus. So again, the follicles will be stimulated by FSH, and you will have granulosa cells and thecal cells that will produce your estrogen. After ovulation, this follicle now becomes the corpus luteum, and it will secrete what hormone? Anong hormone? Mark Kevin. Anong hormone ng corpus luteum? Are you there, Mark Kevin? Hallelujah.
Sorry, Doc.
Oh, anong? Progesterone.
Progesterone and estrogen po daw.
Corpus luteum, more siya ng progesterone. Ha? Yung growing follicle or follicular cells will produce the estrogen before pa mag-ovulate. Pag mag-ovulate siya, corpus luteum will now produce the progesterone. Okay? Again, this is just a cross-section of the ovary. And ito yung medulla niya. You will have blood vessels and the nerves here. And the cortex will have the follicles in different stages. Huh? Ito yung mature Graafian follicle ready to extrude the egg in ovulation. Ito naman yung corpus luteum after nag-ovulate. Ito na yung corpus luteum. Okay? I will produce the progesterone. Huh? Ito yung lining sa ovary, sa gawas, no? Surface epithelium, which will have your tunica albuginea. So you have here the follicle with the ovum inside. So tunica albuginea is the capsule, while a germinal epithelium is here, no? Is the stroma of the cortex, where you will find your different follicles. Huh? my primordial follicles with one layer of lining, okay? And then you will have here the oocyte. This high power section of the oocyte, no? Ito yung egg. And then you will have layers of your follicular cells here, granulosa cells. This is the zona pellucida, okay? So the sperm, the champion sperm will have to pass through the zona pellucida here. Otherwise, the sperm will not be able to impregnate or will not be able to to fertilize the egg. Di ba? Ito yung egg. Buo ito, this is the egg. But it has to traverse through the zona pellucida. Otherwise, hindi rin niya ma-fertilize yung egg. And once the first champion sperm will penetrate through this zona pellucida, it will produce magic. Anong magic niya? We have the zonal reaction, no? There's a zonal reaction that will render this impenetrable to other sperm. So, damo nga sperm, no? There will be millions of sperm that will try to penetrate through, pero usala talaga. Because the first sperm that will enter through will render this impenetrable to other sperm cells. Ito nga, usala talaga nga. Sperm ang makakasugot. Okay? You have the secondary follicle because now of the presence of fluid-filled antrum. May dal siya antrum, no? It is filled with fluid at this time. Okay? Until it becomes a mature Graafian follicle. Diba? This is now a fluid-filled antrum. May daya liquor folliculi. Nagtikada muna. And you will have here the mature follicle, no? A mature egg here. This is now the corona radiata and the zona pellucida. There are two layers that will have that should be penetrated through by the sperm. What are these? These are the corona radiata and the zona pellucida. So dapat pumasok, mag-penetrate through the corona radiata and the zona pellucida ang sperm before it can fertilize the egg. Okay? Once there is ovulation, that corpus luteum from where the egg has come from will be converted into a corpus luteum. So after ovulation, the remains of the follicle are transformed into a corpus luteum. Again, and secretion by the corpus luteum is the progesterone. Okay. And there is degeneration of corpus luteum. It is called the corpus albicans. You will see in the microscope, namo talaga itsura niyo, no? It is pinkish, hyalinized, no? Because of the degeneration of the corpus. Okay, again and again. I had this slide during my lecture in embryology. Okay, you will have to master this because during your revalida, you'll be asked about this diagram. Okay, so yan na pala, you have to understand by heart. You understand by heart what this graph or diagram means? Okay. So it means that during the first half, diba, first half of the cycle, a woman will have rising FSH because it will develop these follicles, diba? Follicle stimulating hormone. After your after the ovulation, no, mag-go down at FSH. What will rise naman, because of the development of these follicles, di ba? From a primary, maging secondary, maging mature graft yan, no? Because of this, no, you will have a rise in your estrogen. Yan, estrogen. Okay? Because the cells here, your follicular cells will produce your estrogen. Kaya ganyan, no? Before ovulation, there is a rise in the LH, luteinizing hormone. So, ang itong before ovulation, if we test a woman for the luteinizing hormone, it is at its peak, magiging positive ang luteinizing hormone. Huh? So again, a rise in FSH before ovulation, a rise in estrogen before mag-ovulate, and a rise in progesterone here after ovulation because it is the corpus luteum and magproproduce ng progesterone. So this is now the developing follicles. Until ovulation, it will extrude the egg. What happens to this follicle? It becomes the corpus luteum. Okay? Pag dili na mako, corpus albicans na yan. Ha? Okay. The effect of estrogen and progesterone, estrogen DD, progesterone DD, it will have an effect in the lining epithelium of the uterus or the endometrium. Okay. As I have said before, the endometrial lining, no, consisting of your arteries and the glands in the endometrium. Very simple lang yung endometrial glands. Straight ang mga blood vessels or the arteries are straight. Okay? After ma-converted siya into secretory phase, ito siya, ano lang siya, the phase, during the first phase of the cycle is called the proliferative phase. During the proliferative phase, straight yung glands, the glands are simple and you have straight lang yung blood vessels. But sa secretory phase, yan, hindi na straight yung mga blood vessels. Okay? And the glands are secretory glands now. We have subnuclear vacuoles and you will have serrated glands. Okay, so I think this is the last slide that I have for the reproductive system. So you should be able to understand the effect of FSH. FSH is coming from the, saan nanggaling yung FSH, Miss Pacoma? Pacoma, Ariel.
Doc?
Saan nanggaling yung follicular stimulating hormone?
Doc?
Saan nanggaling, where does your FSH come from? What produces your follicle stimulating hormone?
The follicle stimulating hormone po is secreted by the oocyte po.
Coming from?
Doc? Sorry, Doc. Mahina po yung internet connection po.
Balit. Okay. So, can you hear me? Can you hear me? FSH comes from the anterior pituitary gland. Okay? You have two parts of the pituitary, the anterior and posterior pituitary. Huh? So, FSH and LH, together with your growth hormone, will come from the anterior pituitary. Huh? While your antidiuretic hormone comes from and oxytocin from the posterior pituitary. Huh? So, anterior pituitary will produce your FSH and LH to help the follicle grow. Huh? Mag-grow yung follicles nyo because of FSH. FSH dito, huh? And then the FSH will help grow these follicles. That's why it's called follicle stimulating hormone. So ang follicle cell here will produce estrogen, while the corpus luteum will produce your progesterone, di ba? Yan. Okay? So dapat you have an analogy and association of FSH, your follicular phase, as well as the proliferative phase, which has your an effect of estrogen. While after ovulation, you will have here, what is produced here is progesterone, okay? And the secretory endometrium. Ito proliferative endometrium. Huh? Dito secretory. So dapat ito, this belongs to each other. This belong to each other, huh? Ito. And this one belongs to each other. Huh? Can you understand? Santos, you understand? So dapat may analogy kayo, ha? FSH. Oh, any question? May question kayo? Especially girls with regards to menstrual period. Kasi before you can have a 28-day cycle or the normal menstrual cycle na waray talaga intermenstrual bleeding, you should have a normal ovarian and uterine cycle. Dapat normal ito lahat, no? Before you can have monthly cycle. Otherwise, hindi magma-monthly yung cycle. You will have every 4 months or you have prolonged bleeding kasi normal na bleeding menstruation is just 3 days to 5 days. Pag more than that, abnormal na yan. So, may defect sa cycle. There's a defect here kung dili normality yung menstruation. Huh? Sige. Do you understand? Huh? So may dakang pakiana, you can just ask me now.
Hello, Doc.
Yes.
Good afternoon.
Oh, Hirini.
Verano po.
Oh, okay. So, what is the question?
Kapag Doc, nakakaduha ka cycle ha 1 month, in a month.
That means you have a short cycle. So it's not also normal. Huh? Anon puan? What is the interval?
Like, second week, tapos mga perala ka days, like 1 week.